A contraction happens when the muscles in the walls of your uterus tighten up. At the start of labor, contractions can be mild and feel like menstrual cramps. As labor progresses, your contractions will feel more intense, occur closer together, and last longer. When labor begins, contractions are usually mild. They help open or dilate the cervix. They also soften, shorten, and thin out the cervix. The name for this process is effacement. As labor progresses, contractions become more forceful. They indicate that delivery is growing near and that your baby is getting ready to leave the uterus and be welcomed into the world. It is important to note that every person experiences labor differently. The first type of contractions that you may feel are Braxton Hicks contractions. These are also called false labor or practice contractions. Braxton Hicks contractions are your body's way of preparing you for true labor contractions. These contractions usually feel like a gentle tightening of the abdomen or, occasionally, like light menstrual cramps. You will know that you are having Braxton Hicks contractions because they do not progress in their strength. Most people go into labor between weeks 38 and 41 of pregnancy. At that time, you may start to feel labor contractions. These contractions feel different for everyone, but real labor contractions feel like a pain or pressure that starts in your back and moves to the front of your lower abdomen. During contractions your belly will tighten and feel very hard. You may feel your abdomen becoming hard when the muscles of your uterus contract. As the muscles relax, your abdomen will feel soft once again. During early labor, the contractions may feel like a dull ache or pain. As your labor progresses, they usually become more intense and painful. Labor contractions happen in a regular pattern and get closer together. These contractions feel like a wave. They start slowly, reach a peak when the sensation is most intense, and then recede. What causes contractions? As you approach the end of your pregnancy, the density of oxytocin receptors in muscle layers of your uterus increases. During labor, when your body releases oxytocin, the oxytocin binds to these receptors to stimulate contractions. As pressure on the cervix and in the birth canal increases, neural pathways send messages to the brain to release more oxytocin. This leads to more contractions. What is the timing of labor contractions? Timing the intervals between your labor contractions can help you to determine the stage of labor you are in. These stages can be different for every individual. Early labor. Early labor is the longest stage and lasts around 12 to 19 hours. Your contractions may last 30 to 45 seconds. They may occur inconsistently or may come at intervals ranging from 5 to 30 minutes. Active labor. This stage commonly lasts 3 to 4 hours. At this stage, your contractions will become more forceful and last about 45 to 60 seconds each. The contractions will come at regular intervals of 3 to 5 minutes. Transition. This is the most intense stage, but it is also the shortest. It lasts between 15 minutes minus 1 hour. Contractions during this stage may last about 60 to 90 seconds, with intervals of 30 seconds to 2 minutes between contractions. Here are some other symptoms that may show you are in labor. Sensation of pressure in your vagina or pelvis. Significant pain in your lower back and abdomen. Loose stools or diarrhea. Some difficulty breathing through the contractions. A trickle or rush of fluid that indicates your water broke. Brown or pink discharge that indicates the mucus plug loosened. When should you contact your doctor about contractions? If you feel that you entered the stage of active labor, contact your obstetrician or nurse midwife. If labor seems to be progressing, consider going straight to the hospital or wherever you plan to give birth. Unless you've come face to face with an all-encompassing contraction during labor, you don't really know how far the threshold of pain can go. Hey, so tell us how you managed your contractions in the comments section below. And thanks for watching Tiny Tribe Parents. If you enjoyed this video, please click the like button, comment and subscribe to our channel for more incredible content that is on the way.